me a short, just a short overview of what we've been doing in the service since the outbreak of COVID. So in the service, as you probably know, the service has been around for many years now, about 15 years. And we provide a whole range of different community programs, courses, initiatives that are focused around health and well-being. So we deliver a whole range of different things around things like weight support, stop smoking, healthy eating, emotional well-being, social support groups, lots and lots of different things, and they're all located at a neighbourhood level. So we've got teams of staff that cover all the areas of Salford, but they work very, very locally within that community. And so obviously the majority of these programmes that we run will run face to face. So at the beginning of the COVID outbreak, we've looked at how we can provide a virtual offer. And so we've developed a package that we're calling Health Improvement Connect. And it's about ensuring that people are able to still access these lifestyle and wellbeing services whilst the pandemic is going on. We've tried to focus the provision around some core areas. And these core areas are things like adult weight support, stop smoking, some physical activity, and some of that is provided virtually, and some of it is provided in outdoor environments, so in parks. It's things like cycling and walking, and some exercising outside. And then we've also got some emotional support, which is focused mainly around people who might be feeling a bit lonely or isolated. But really what I'm here to talk about today in more detail is about the Red Pepper programme that we provide, and that's specifically for children and families. And it's a family weight management programme, and we've run it for many years in Salford. And we've had some really, really fantastic results with the families that are accessing the programme. And I just wanted to remind people that are here today that the programme still exists and it's still running, and people can self-refer into it, or anybody could refer them into it. It's accessible for everybody. Obviously, it's targeted around families that have got a child that's above a healthy weight, but we wouldn't turn anybody away. Anybody can join in with the programme. And so what we've tried to do is to develop a virtual offer for this programme as well. So people will get some one-to-one support over the phone or using technology, as well as some group support that they can join in with. And then alongside that, there is a physical activity offer. So the Red Pepper programme, it's focused around behaviour change. It encourages things like goal setting, looks at portion size, fats and sugars, fussy eating. There's a survival guide for parents. Those are the kind of topics that are covered on a weekly basis. And then normally when we're not in like the pandemic time, there's physical activity that runs alongside that, and we encourage the family themselves to choose what kind of activity they want to do, something that's really interesting to them, something they've always wanted to do maybe. So in the past, we've done things like water sports, we've done things like trampolining, Thai boxing, all kinds of things like that. And so we will support families to be able to access that and pay for them to be able to access that support, so that the physical activity is something that they're more likely to continue with when the programme ends. Obviously, we're a bit more limited at the moment now with us being in this COVID pandemic. But we will always look at like creative solutions to encourage families to participate in that physical activity that's so important. We've found in the past that sometimes it can be quite difficult to get families to engage in the programme. And I think some of that's linked to some of the presentations we've had earlier around families feeling stigmatised, but we very much try to present it as a really positive thing. It's certainly positive and not about blaming families at all. It's really encouraging. And I also think that from some of the feedback that I've had from families is that sometimes they really, really lack the confidence to feel like that they can make a change and that it's possible. So we will spend lots of time with them, encouraging them and sort of saying, you can do it. It is possible. We've got lots and lots of families that have done it. So once people get engaged with the programme, then they really enjoy it, and the feedback's really positive. And over 70% of families will remain throughout the whole programme and complete the programme. So once we can get them, it works, but it's just getting them that can be difficult. We've got really, really fantastic results in engaging with families from different ethnic backgrounds. We have a really, really high proportion of families that come on the programme from BAME backgrounds, which is brilliant. And once people complete the programme, over 78% of families that come on the programme will make positive changes to their diet or their confidence around food and or to their well-being, all sorts of different things we measure. And 65% of children that come on the programme that are above a healthy weight will reduce their weight. So, you know, it is an effective programme, and we've done lots of evaluation of it. So that's all I really wanted to tell you about the programme. It was more just to remind people that it's still happening, and we welcome referrals and people self-referring as well. I think that I've got a slide, I think, that just tells you how to access the programme. Is that the next one on there? That's it. So there's a link at the bottom of the page there. But if you just Google Salford Health Improvement Service, we come up as like the first thing that you find, and you can access it there. And there's a free phone number you can ring if you want, or people can just refer through that, and we'll pick it up. But there's no waiting list or anything like that. We'll contact them within a few days and get them started. Thank you.
Thank you, Angela. Thank you very much indeed. Again, we have said that although this is very Salford-centric today, we do really want to engage with colleagues across Greater Manchester. We know there are lots of really good and similar things taking place in other cities across the conurbation. So if we can engage in that way, we want to encourage post-conference debate around all of this. So thanks again, Angela.